Thanks everyone for staying and engaging. We have a treat. Everybody knows that mentorship is not just for young people, early career investigators. There's all kinds of forms of mentorship. I hope we're going to discuss some of those. And I understand our three speakers this afternoon have very graciously got together before this meeting to discuss the scope of what each may cover and rearrange the order in which people will present. And we're hoping to have all three up at the front for some conversation. So they're abbreviating their presentation so we can dialogue after. And I'll introduce the first speaker as of now, Dr. Lehana Thabane from St. Joseph's Hospital, affiliated with McMaster University. I'm very honored to call him a mentor of mine in everything complicated, biostatistically speaking, for advanced trials. And he's head of our research institute and vice president of the hospital and works with Population Health Research Institute and large international trials. He's mentored hundreds of people from around the world and is very engaged internationally in research mentorship as well. So Lehana is going to kick us off. And then after that comes Dr. Joan Murphy, also formerly from Hamilton. She's spent some time with us, but has been based at UHN in gynecologic oncology, has had major leadership positions, including clinical trials for oncology for the province, and has a lot of national clinical, administrative, academic leadership posts, and will be telling us about her mentorship experiences and observations, particularly over the last near decade at Trillium Health Partners Program. And finally, we'll be hearing from Dr. Laura Foxcroft. Interestingly, also has spent some time at McMaster University for medical school and family medicine, and has done additional training in emergency medicine, spent some time working in the Emerge and in the ICU in Kingston and in Ottawa, practicing emergency medicine. She's here in her role from Western University, School of Medicine and Dentistry in London, where she works on faculty wellness, the antithesis of the burnout that we hear so much about. So we're in for a treat for all three of these people. And I'd like to start off with Dr. Lehana.
All right. First, I have to say thank you to Deborah for inviting me. And I just wanted to say kudos to the PSI Foundation. I think you guys are doing a fantastic job. And I was just saying earlier on that I raised my hand to volunteer to help if I can be of any help. Only because really I believe in your mission and your vision, and I have had colleagues and mentees who've greatly benefited from this program. I have no conflicts to declare, anything that I can think of. But funny enough, as a professor, I get credit for giving talks, so I often have to declare that conflict. I'm going to talk about two things, and I'll be very brief about the two things, because whatever I'm going to say is going to look so straightforward. What is it, and what is not mentorship? And then I'll talk about, in particular, is there any evidence to support that mentorship actually helps? So what is it? You know, the word itself, it comes from Greek. And really, it was Odysseus who was trying to get somebody to help, their son, call that person a mentor. And that's how the word really came about. And if you look at, the synonyms in various dictionaries, it has all sorts of synonyms that go with it. It could be somebody who is a guide or a counselor or a coach, and people have used it many times. I was trying to actually introduce the concept of formal mentorship in biostatistics. I'm a biostatistician by training, and I could let people see that there's so much a mentor can do for you, and you're never too young or too old to get mentorship. Right? Even I still have mentorship now. Deborah, even though she says I'm her mentor, she's actually my mentor. And there's people who I have mentored who have become excellent mentors for me. So really, they can do so many things for you simultaneously as you run through life, or even sequentially during that journey. In almost all cases, they tend to have certain behaviors that we all look for when we're looking for a friend or support, that people who really are nurturing, they're very encouraging, they're very supportive, and they also have traits that we're really looking for when we're looking for someone who we can actually use as a pillar of support. Pretty much all these attributes is what attracts us, and they tend to have a track record. But quite often I say the ideal mentor is a person who makes the decision that they're going to be a mentor. And I tell every one of my students that for whom much is given, much is expected. If you're looking for a mentor, it means you yourself have to be volunteering to mentor somebody. And the reason being, quite often people who make this decision, they tend to look for ways to actually equip themselves with the skills and the tools to be able to be effective at it. But people who are actually chosen to do it, but they really don't want to do it, they don't tend to do that. So I say making a decision to be a mentor itself is the number one criteria for success in doing it. What is it not? It's definitely not insurance. This is actually Mita Giacometti, one of our colleagues who was a dear colleague, and she retired. But I never forgot her words that, reminding us that mentorship is not insurance. It's certainly not supervision. Not to say that supervisors can be good mentors, but certainly the two are very different. And it's not an indefinite relationship. Like any relationship, there will be ups and downs. There's got to be a way of how do we deal with things when things don't go well, and at what point we terminate the relationship or make a transition from that relationship as well. I believe in it, and I've written about it, and every opportunity I get to talk about it, I keep talking about it. And I try to cultivate it in everything I do, including in grants review. And I was encouraging earlier on that one of the things you could do as a program is to actually formalize your mentorship program so that the mentees who've succeeded in this program can come back and serve as mentors. They can also come and observe how you actually run things so that they can become better mentors themselves. Now, why mentorship? I'm just going to show you one piece of evidence that we actually desperately still need this, a bit more committed to doing it. So we're looking at leadership in clinical trials and looking at what's the involvement of females in leadership for clinical trials. And we look at the evidence in cardiology. And this is two of my mentees who sometimes are my mentors at McMaster. And what we found was that women were underrepresented in leadership in clinical trials, particularly in heart failure. So just looking at those who were lead authors, you actually find it's mostly males who were lead authors, not females, all right? And we thought mentorship could actually be a solution to this. And then we looked at what about in steering committees of clinical trials? And what we found was that while there seems to be like, there are 52% of these steering committees include women, actually they only represent about 11% of all the members of those steering committees. So that doesn't look good. In other words, overall, females as members of steering committees, they're underrepresented. Females as lead authors of major clinical trials, they're underrepresented. Cardiology is not the only area where this happens. It happens in a lot of clinical areas. We have to be deliberate in trying to change the landscape. One would argue that actually we are intervening too late in the pipeline. But at the very least, if we are all committed to changing it, I think it can actually happen. So I think deliberate mentorship is part of the strategy to actually change it. Why? Because the evidence is very clear that there's some benefits. Where is that evidence? It shows that actually people who are mentored are much more satisfied about their career than those who are not mentored. They're definitely much more productive than those who are not mentored. When you look at all the metrics for academic productivity, they tend to be promoted faster and easily, more easily than those who are not mentored. And certainly it's a strategy to retain people. I've seen people who are actually not mentored become so unhappy that all they can think about is the fastest way to get out. So I would say certainly the evidence is there that it actually is a very useful strategy. But here's another good thing about it. It doesn't only help those who are receiving the mentorship, but it also helps those who are given the mentorship. A few days ago, actually, we had a symposium in Hamilton celebrating the 3 Wishes program in Hamilton. Deborah actually was the founder of that program. And we had a speaker from Calgary, I think. His name is Shane Sinclair. He runs the Compassion Lab in Calgary. And one of the things he said was that his lab has shown that there's evidence showing that being compassionate is not only good for people who are given the compassion and those who are receiving it, but those who are witnessing the compassion or acts of compassion are also benefiting. And it's the same thing with mentorship. Mentorship is about giving. It's not only good for those who are giving it, it's good for those who are also receiving it, but it's also good for those of us who are watching it because it's good behavior, it's fulfilling, and we all feel like, how we could actually help. What about the attributes? There's evidence showing that really these people who engage in these activities tend to have the kind of attributes that we're hoping for. If they are mentees, their mentees are on the driver's seat, they are respectful, they are organized and committed. And when it comes to mentors themselves, they tend to be really honest and non-judgmental. Why? Because they pay attention to behaviors that are actually constructive rather than behaviors that are destructive. So you can see that really there's evidence in supporting a lot of things about mentees. What about the actions they engage in? Because of the determination and the commitment they make to help or give to somebody else, they actually tend to engage in behaviors that will ensure that those outcomes will be achieved. So you can see that actually the evidence is very clear that being deliberate about this, people do pay attention to everything they do in terms of even how they do it. And all these things are really very, very positive when it comes to mentorship. In many ways, they tend to also go beyond the call of duty to protect their mentees against all the politics of institutions. So I would say certainly being deliberate to create a mentorship program and finding ways to equip not only the mentors and the mentees with the skills, but also helping institutions to come up with these programs would actually be the best way to do this. I just wanted to give you a sense that a lot of this evidence is actually captured in the book by Dave and Sharon. And I think Sharon continues to update the evidence. If you want to look at Dave, before they passed away, he actually was running clinician rounds for the Journal Clinical Trials, and has documented a lot about various things that could help junior investigators actually do a much better job as they build their skills as academic clinicians. But he spent about 4 of those rounds on mentorship. That tells you how important it is. It is the only topic for which he spent more than 2 rounds. I mean, you can see this is really absolutely essential, and I think really supporting junior investigators in clinical medicine is about the best thing we can do. I think I'll stop here, and hopefully this gives my colleagues a good starting point.
Thank you very much. I'm going to build on a number of themes that have been introduced. As I hear the discussion just prior to, when I just came in, prior to ending the last session and looked around, I'm not sure I'm going to tell you much you don't already know, but I do want to thank you for inviting me to come and speak today, and also organizing my thoughts around mentorship. I want to start with a personal vignette. When I entered medicine, which was, I think the dinosaurs were just extinct at that point, but it was a long time ago. And I wanted to do primary care. I have spent my life in a surgical specialty, however, subspecialty. And it all dates back to a day when I had a so-called exit interview, which was passing in the hall with my supervisor when I finished a surgical rotation. And the sum total of the interview was something like, "You got good hands, Murph, don't waste them." Now that was past for mentorship at that point, and in fact it changed my career. But hopefully we can do a little bit better as we move forward and get a little bit more organized and scholarly about mentorship. As Deborah said to you, my name is Joan Murphy. I am formerly practiced gynecologic oncology, and I now am the Chief of Staff at the Trillium Health Partners. I have no conflicts of interest. You've seen our learning objectives, and as I said, I will hopefully build on some themes that have been introduced, and then our third speaker is going to talk about implementation, what really to do with all this. So as Lehana said, mentorship has a high impact on achieving optimal performance in all healthcare professionals and in many other professions as well, but we're talking about healthcare today. However, it has not traditionally received the attention, the evaluation, or the recognition proportional to other contributions that we as teachers and leaders provide. So one of the issues is that there is no widely accepted definition, so it's very difficult to quantify, to evaluate, to structure. However, various descriptions that I came upon, I think, are of value here. One is a two-way relationship and type of human development in which one individual invests personal knowledge, energy, and time in order to help another individual grow and develop and improve to become the best and most successful they can be. Another description is a longitudinal process that guides personal and professional growth through ongoing dialogue. And another one is a professional working alliance in which individuals work together over time to support the personal and professional growth, development, and success of the relational partners through the provision of career and psychosocial support. So we're focusing on academic medicine today, but as I say, I believe these kinds of descriptions pertain to all sorts of healthcare professions and academic and other forms of success. We know, however, that becoming a mentor and engaging in a mentor-mentee relationship involves a series of high-stakes interpersonal encounters and exchanges, and we'll develop that a little further. So there is overlap, however, with other things that we do as we progress in our profession and as we hopefully bring along the next generations. Mentoring is ongoing and dynamic. It involves checking in on a regular basis, listening, sharing wisdom, directing, supporting, and collaborating. It's not the same as, even though there is a lot of overlap with coaching, which is typically periodic, iterative, often on technical skills or specific skills acquisition, and you see further description there. It is also similar to, but not the same as, sponsorship, which is often episodic and involves specific advocacy designed to help an individual with a specific aspect of his or her career. And nor is it exactly the same as role modeling, although role modeling is often intrinsic to mentoring. What can it achieve? Well, it's been described as a catalytic factor, which I love, that term catalytic, when you think of what it can do for young people developing their careers, to unleash their potential for discovery and curiosity. It assists a learning or a junior in seeing themselves through the eyes of an influential guide, finding their place in education and their career. So again, very, very powerful. We know that it influences career decisions. Mentoring someone early in their career can often help them choose their specialty or choose their field of academic endeavor. And we know that it also impacts recruitment and retention, either into a certain field or to an institution. If it also enables academic and other elements of career success, which it can do, it will help with retention as well. It really, in its best form, it is holistic, and it involves both the professional and the personal development of the individual. And as Deborah was talking about burnout earlier, there is some evidence to suggest that it reduces stress and burnout in the career. I think mentorship probably, as we think more and more about equity, diversity, and inclusion, we need to think about underrepresented groups. Lehana spoke about women in leadership in clinical trials, but we also have other underrepresented groups that we have to think about. And I like this quote that's taken from the Science of Effective Mentorship, which I'm going to talk about more in a minute, that observes that talent is equally distributed across all sociocultural groups, but access and opportunity is not. The most effective, the most attention we probably need to pay to providing mentorship is to those underrepresented groups as we move forward toward inclusiveness in academia. Also, there is a module called Mentoring Across Differences, but even if that module alone, that specific module is not considered, learning how to mentor across differences is important, and we probably ought to be providing dedicated training to our mentors, especially our folks just becoming mentors. What are the models? Well, the most common is the dyadic model, which is a mentor-mentee, but there's often a triad where there might be sort of stratified levels across a group of 3 levels of experience and accomplishment. There's group mentorship or network mentoring, peer mentoring, cascading, which often is involved with social determinants of health and or social inclusiveness, I should say. We've learned through the pandemic that virtual mentoring can be effective, and there is some evidence in the literature to demonstrate its effectiveness. And very often there are combined programs. So for instance, there might be a mentor-mentee relationship within a medical school or a residency program, but also group mentoring taking place at the same time. So what are the essential elements? I think Lehana's talked about many of these. One is trust. In the absence of trust, effective mentorship is not going to take place. There has to be some degree of concordance in identity, whether that be the shared values, beliefs, and interests, or at some level lived experience. I think Lehana also alluded to intentionality. It is not casual, such as my hallway encounter with on my exit interview. There should be intentionality with express commitment of the mentor and the mentee to the process, and there also has to be accessibility of one to the other, or within a group if it's a group-based model. I've said competency-based here because I think we know that junior mentors are probably likely to be more successful as they acquire experience with mentorship and get better at it, which is no big surprise. Active listening we talked about earlier. When tools such as maps or checklists or some sort of documentation of what the goals of the process are, those things also enhance mentorship. There has to be a match. Even if you have the identity concordance that I've talked about above, there has to be mutual respect. And if for any reason that's absent, the mentorship relationship will not thrive. And there also has to be cultural responsiveness. So what are the benefits? Well, the mentor obviously acquires benefit as well as the mentee. It improves his or her leadership skills. It challenges them. It provokes them to hopefully a continuous learning, and challenges beliefs and behaviors that can become entrenched over time. It allows the mentor to pay it back, because most of us presumably have had the benefit of mentorship at some level through our training, and it allows us to pay it back and also to pay it forward to shape the professionals of tomorrow. For the mentee, I like this quote because it summarizes in very conceptual terms, describing the mentor as the guardian angel that prevents you from hitting yourself when you know something is falling from the sky, and moves you out of the way, keeps you out of trouble, and also makes the environment suitable for you to grow. So again, very casual terms, if you will, but I think that is a very nice summary of what a mentor can do to a junior learner. So we need to think also about ineffective mentorship. What gives rise to ineffective mentorship? Well, lack of commitment. We've all seen people who have fallen into a mentorship role who are either not committed to it or have not taken it seriously or just don't have the time or the skills, perhaps. So the commitment to make it successful is critically important. If there are personality differences between the mentor and the mentee, or the group that the mentee belongs to, that will not be effective. If there's any element of competition, and we've probably all seen mentors take on a mentee and end up in a competitive sort of arrangement with them, or have some sort of conflict of interest, such as expecting the mentee to contribute to his or her research agenda or the like. And as I've said, inexperience can be overcome over time, but it can have side effects. And the consequences of an ineffective mentorship relationship are really important. They're significant. They can be bruising. They can take someone down a path that was not intended. The National Academy of Science, Engineering and Medicine report that I've referenced previously in this presentation made these recommendations for effective mentorships. One, that the institution and the program should adopt an operational definition. And that's not really to box people in to a rigid definition, but really rather to allow evaluation and possibly modification of the mentorship program. Use an evidence-based approach for support. Again, look to the literature and also generate one's own evidence as you move forward. A structured assessment and evaluation, and evaluation can't be done without structure. Recognize and respond to various different identities within the population that is being mentored. Support multiple mentorship structures, because one size does not fit all, either the program or the individual, or the individuals, I should say in plural. Reward effective mentorship. It takes time, it takes energy, it takes courage and generosity to be a good mentor, and we all need to have that rewarded in some way, whether it be a pat on the back or taken into account for promotion and tenure, or even financially, because the financial impact of mentorship is not inconsiderable. Mitigate any negative experience. There has to be a safety net should things go wrong for both the mentor and the mentee. And when I came in, the conversation I was hearing raised the issue of funding agencies supporting mentorship in ways, for instance, of increasing the score of a submission if a mentor is involved in the proposal, in the funding proposal or the like. And then obviously encouragement of ongoing mentorship research and scholarship, which probably becomes more and more important as we move forward in the complicated world of medicine, of science, of academia, and also as we move toward inclusiveness. And to end, I just wanted to end on this nice little diagram that I thought was a nice thought structure, if you will. It's kind of like a co-pilot relationship. And this, again, is from the National Academy of Science, Engineering and Medicine. Building trust over time among the parties. Both parties or all parties have a role in guiding the relationship. Be open to change as conditions change, in navigating turbulence if it evolves. Communicating openly and freely and consistently. And then expecting improvement with guidance and commitment in the skill both of the mentee, which is obviously the focus, as well as the mentor. So, thank you. I hope that's given Laura a framework to build on to talk to us about implementation.
Thank you for inviting me to speak today. I know I am the last speaker, so I hope everybody has some energy to hear about our program at Schulich, because I'm very excited to be able to talk about it. Thank you, Robin, for inviting me, and thank you to my dean at Schulich, Dr. Joan, for actually supporting faculty mentorship in our strategic plan since 2020. So clinically, I work as an adult emergency medicine physician in London at London Health Sciences Centre in St. Joe's. And in my academic role, I have a great job at the university a day a week as the Assistant Dean of Faculty Wellbeing. In that portfolio, there's two things to my portfolio: faculty wellbeing and faculty mentorship. So the faculty mentorship component is what I'm going to speak about today. And today I really want to provide an overview of the Schulich faculty mentorship policy that exists at our school, to discuss the strategies to effectively operationalize a faculty mentorship policy, and then to discuss how faculty mentorship can potentially improve patient care. So the Schulich Clinical Faculty Mentorship Program or policy, it was established in 2010. It was a policy that was developed by a group of very progressive faculty at our university that stated that every clinical faculty at time of hire was to be offered a mentorship committee. This policy was the first of its kind in Canada to support faculty at an academic university, and it was unique in that it stated there needed to be 3 people on the committee: the mentee, a mentor from the home department, clinical department, that was an associate or full professor, and then a third mentor from an outside clinical department that was an associate or full professor that shared a similar academic role category. And at Schulich we have 5 academic role categories. You can be a clinician teacher, clinician researcher, clinician educator, clinician administrator, or a clinician scientist. So the person that was on the outside department committee needed to share the same academic role category. This policy really allowed for collaboration at our institution between clinical departments, and it really provided much needed support for faculty at the very early stages of a faculty member's career. At Schulich, you need to be promoted to career rank, which is associate professor, by year 7. And we were finding that support of mentorship committees was very helpful for people in achieving that goal. In 2018, our conditions of appointment were renewed. That was 10 years later than when the mentorship policy was created, and then it was embedded into our conditions of appointment that people needed to be offered the mentorship committee and that it was to be led by the chair of the department in getting it organized. So why is mentorship important? As my colleagues have already said, new faculty benefit from the experienced input of more seasoned faculty, senior faculty benefit from the junior faculty perspective, and institutions benefit from increased academic productivity. We know that institutions with supportive cultures thrive. A Schulich Faculty Mentorship Committee provides many benefits to the mentee at the assistant professor level. Every time the mentorship committee meets, it's suggested that the faculty member's acuity star, which is our online CV, is reviewed before the meeting takes place, and the mentors then become very familiar with the academic contributions of their mentee. Many of our chair chiefs then call on the mentors to write awards for their mentees, because they're often more familiar with the contributions than what even their leaders are. Mentors often provide wisdom to junior faculty, not only on opportunities that may exist to become involved, but even more importantly on when to pass up opportunities that are just filler, that may be actually contributing to burnout or a lack of well-being. Being a member of a Schulich Faculty Mentorship Committee has many benefits for our mentors. Generally speaking, the people that volunteer their time, it's 1 hour, twice a year. It can be done in person. Since 2020 now, it can also be done on Zoom. They find it highly energizing to get to know the junior faculty, not only in their own department, but junior faculty in other clinical departments doing work that may have crossover with the work they are doing. Overall, they don't find the commitment too overwhelming, and they really enjoy getting to know the junior faculty. Another perk of sitting on a faculty mentorship committee, our university, and this is really in thanks to our dean, is that your work on a mentor committee counts towards your own academic contributions and can be entered into our Acuity Star, which again is our promotion CV. So then, as a more senior faculty member, when you go up for promotion to full professor, your contributions as a mentor are highly valued. We also have developed an institution award for faculty mentorship, where every year we recognize exceptional contributions to faculty mentorship. It's an award that's then valued at national and international levels. So how has this Schulich Faculty Mentorship Program and policy been operationalized across our 17 clinical departments? It was developed in 2010. It was embedded into our conditions of appointment for clinical faculty in 2018. We did a quality improvement survey to say, how was this actually operationalized? What we found was that there was large variation. Some clinical departments had a robust mentorship program running with lots of administrative support. Everybody had a committee. The committee was meeting twice a year. Minutes were being submitted to the chair chief, and there was lots of diversity on these committees. Some departments were at the other end, where there was no mentorship at all, despite there being a policy, despite it being embedded into the conditions of appointment. But most of our 17 clinical departments fell in the yellow zone, where there was mentorship, but there was lots and lots of room for improvement. So in 2020, we formed the Schulich Faculty Mentorship Oversight Committee, and it's a committee that now has representation from each of the 17 clinical departments. We have a member from each clinical department that is passionate about faculty mentorship, passionate about improving it in their clinical department, and this committee now meets 4 times a year as a group to ensure that faculty mentorship is progressed. Based on the work of this committee and the evidence that my colleagues have already discussed that exist in the literature about faculty mentorship, we developed 4 strategies, or things that we wanted to implement across our school to optimize our program, to make sure that it was operationalized in all of the clinical departments and that it was thriving in all of our departments, and that eventually all 17 of our departments would be in that green zone with thriving mentorship program for our faculty. The first thing we did, we developed the Faculty Mentorship Oversight Committee. As I said, this committee meets 4 times a year. There's a passionate representative on that committee from each clinical department. That person reports directly to their chair and helps to make sure that every faculty member in their clinical department has a diverse committee set up, that those committees are meeting, that minutes are being submitted, and that whenever there is a need for change in the committee, that person is offered as a resource. The second intervention that we did to make sure that the program was operationalized is that we developed a documentation template for mentorship meetings. This template is on our website. It's kind of cut off on the bottom here, but essentially what it does is it follows all of the academic role categories that is in the physician's contract. So it goes over their clinical work, their teaching, their research, their administrative work, their healthcare leadership, role modeling. There's also a point that you can't see on the bottom of supports needed and just how we can best support our mentors. So this is filled out twice a year by the mentee. The whole process is mentee driven, and the minutes are then distributed to the committee as well as to the chair of the department, who then takes these 2 sets of minutes every year, reviews them at the annual review to see how they can be a best support. The third strategy that we implemented was a web-based mentorship matching portal. What people were finding was difficult was that if you were a clinician researcher in gynecology, how do you find a clinician researcher in another clinical department that may have similar academic interests? How do you know those people, especially if you didn't train at our center? How do you go and find those people? So what we did was we created this web-based matching tool. It matches people by their academic role category, their broad academic interests, and allows people to find diversity on their committee. People fill out a consent form to have their name put on this website. It is open access, and there was a bit of a competition, I think, between departments as to who could have the most mentors on our matching website, and I believe pediatrics has the most right now. All of the mentors that put their name on this website have to have completed our training, which is evidence-based in faculty mentorship. And that was our fourth initiative. We developed a web-based training program that was intended for mentors, mentees, as well as the chairs of all of the clinical departments. This is evidence-based. It goes over all of the best practices that have already been discussed with respect to faculty mentorship. The time it takes to do this training is 2 hours. It's asynchronous. It can be done in your own time. And we found this was excellent for physicians because the only other training tool that existed at our university was a 3-hour, 5 times in person at Central Campus, and no physician was ever willing to give up that amount of time to take formal training in mentorship. So this was 2 hours. It's accredited by the Royal College as well as the College of Family Physicians, so people get credit for taking it. We're in our second iteration of this now. Our next iteration has an EDID focus, and we have brought in an expert, Dr. Tisha Joy from our center, who talks about the impact and the special considerations for EDID when it comes to mentorship. So after we implemented those 4 things in 2020, we then repeated our inventory survey in 2023 to see was there a quality improvement in how our policy was implemented, was the operationalization of it better. 16 of the 17 departments provided feedback, and the questions were very similar to the first survey pertaining to the program support, processes, document usage, and then the diversity of mentors that was occurring on committees. What we learned was that establishing a policy on faculty mentorship in a large academic institution is really not enough. 10 years after the policy on faculty mentorship was implemented at our center, operationalization of the policy was variable at best. Implementing and operationalizing the policy that impacts physician well-being really in a robust fashion takes time, and it really takes deliberate effort by a dedicated team of people. We found that training faculty regarding the value and the process of mentorship was an enabler, and that the standardized templates that we created for recording mentorship meetings were very important. Communication between the faculty members as well as their mentorship team and their leaders. The mentorship meeting minutes really gave leaders more information on their faculty so that they knew what they were doing and what supports were going to be needed. Other practical implications: continuous quality improvement of this faculty mentorship program at our large academic institution is needed. Having a local policy for academic promotion really is a key driver to motivate faculty at our center to engage with the mentorship process. And then having a standardized mentorship process that's equitable for all diverse faculty in every clinical department with an EDID-sensitive lens is very important. The cross-departmental nature of our mentorship committee really leads and is continuing to lead to increased collaboration in teaching, in administration, in research that's occurring at our center. This policy, the program, as it's been further developed and implemented, has really resulted in institutional culture change in that there's greater collaboration between all of our departments. This is a last slide about how does mentorship impact patient care. As a healthcare system, we need to continually look through a quality improvement lens with respect to patient care. How do we as physicians provide optimal patient care? We know that physician well-being relies on 3 factors: the individual, the culture, and the system that we work in. And if one of those factors is 0, it's a sum, and then the physician well-being sum is 0. The data from the Canadian Medical Association's 2021 National Survey on Physician Health, which my colleagues presented on earlier today, is very concerning. It really suggests that 60% of physicians indicated that mental health was worse, 50% responded positive for depression, and half of all respondents are considering decreasing their workload in the next 24 months. I do believe that robust faculty mentorship programs at institution level can help to address physician well-being at the individual level, but it also can improve physician well-being at the cultural level. And that's what we've noticed at our institution, is that there is greater culture now between departments academically. We have a website. It has all of our resources, our training program, our policy on faculty mentorship, our mentorship oversight committee, the mentor minute meetings forum. It's all open access, and you're free to access any of our resources.
We have some time for reflections, comments, and I'd like to start. Andrea?
You mentioned sponsorship, and I wonder if you might elaborate. I seem to recall an article not long ago that said that it's not mentorship that we need, is we need more sponsorship. Well, I guess they were talking specifically about women in academic medicine. I don't know if that comes across in other panelists as well, but can you have that without mentorship? And
So I look on sponsorship as a bit like an extension of mentorship. I think, as I say, mentorship is ongoing and really builds the foundation of achievement and fulfillment for the junior or for the learner. Sponsorship is often very deliberate, very specific, opening doors, introducing opportunities, et cetera. So they can certainly be intermingled. I just think it's very helpful in our minds and in our systems to look on them as somewhat separate, overlapping, but separate. Sponsorship would have a very specific goal, getting somebody on a grant, getting them have experience X, Y, or Z. Whereas mentorship, I think, is more of a foundational sort of ongoing process. I don't know, Laura, if you have anything to add.
Just that I think it's really important, and I think physicians need coaching, mentoring, and sponsorship, and I think they're all separate and unique. It could be from the same people or from different people, but I think mentorship helps to identify who those potential sponsors could be in your career.
It's a great, go ahead.
yeah, I guess I'm just thinking about, like, your mentor knows you best, or hopefully gets to know you, so they're in a position where they could sponsor you more. And is that what we need in academic? Should that be an expectation of our mentors, I guess? If they're able to, obviously.
Outcome, I would advise all mentors to take advantage of sponsorship opportunities or seek out sponsorship opportunities if they can't offer them to their mentees. So yeah, I agree, they're complementary 100%. I don't think they're totally overlapping.
So would you say someone can sponsor an individual who maybe does not have a formal or even informal mentorship relationship with that person?
Definitely.
A sponsor can be like out there.
Right, 100%.
Okay.
Yeah.
Could I ask John Drover, who knows a lot about coaching, we were discussing earlier, picking up some of the threads that were mentioned earlier about how coaching relates or is distinct from mentoring.
Since Deborah called me out, I'm a certified executive coach from Royal Roads University. So I'm interested in this because I do mentoring, I do coaching, and I do see them as being different, but certainly with lots of overlap. The coaching piece is, the definition of coaching from the ICF is a partner with a client in a thought-provoking creative process to maximize professional and personal potential. It has a lot of overlap with what we're talking about in terms of mentoring. Applaud the idea that mentors need training. It makes me think about early in my career the thought that because somebody had finished a residency that they were now automatically able to be a teacher.
Yeah.
And so I'm curious, as you think about training mentors, what are the competencies? Because some of what we saw, I think in the first presentation, was about the personality traits of somebody that makes an effective mentor. But what are the competencies you think that embedded in that we can help with people becoming more effective mentors?
Well, so that's a very good question, actually. What are the things we can equip the mentors with? In other words, can we build mentorship skills? The short answer is yes, because it's about equipping them, one, with the things that can make them effective. If part of the mentorship is going to be sponsorship, you've got to be aware of how to identify opportunities to be able to sponsor somebody. So there's certainly things that we can help mentors to build. The other thing is just resources. We can actually provide mentors with just resources to be able to actually do what the advocacy. Can we build skills of someone in advocacy? The answer is yes. We can build the skills in advocacy. Can we build them with skills to be able to find different ways to protect their mentees? The answer is yes. So I think there's things that we can actually help the mentors with, but there are also certain things that mentors are born with, which are certain traits that we can't change, like the personalities and so on. But there's certainly certain other many areas where we can help them to be able to be aware of where they lack certain skills that would need to be improved. For instance, if part of it is to help build their communication skills. You got to be an effective communicator as a mentor to be able to help somebody to do that. So there's various areas where there are skill-based competencies that we can help to build in a mentor. But there's certain areas which mentors are just born with. The others is, it's about learning. Mentors can also learn how to become good at something. And I think all this could be part of a deliberate program of helping mentors to be able to actually get more connected with other mentors. A lot of what I've learned myself, I learned through trial and error, believe it or not. Although at some point I started actually becoming more deliberate to take training, because the people I was connected with who were excellent mentors, they actually went for training, formal training to become, and I realized, actually you can get trained to do this. So I think there's a lot we can do that many people who would like to help, everybody would like to help, but most people don't know how to help.
Thank you. More on competencies, Laura?
Yeah, I just think that's a great question, John, about competencies of mentorship, which is why we developed the training program at our center, because I think all of us have experienced terrible mentorship in our career, and you gave that example, where it was somewhat helpful but not really. And so our training program actually goes over the bare minimum basics and expectations to be a mentor at our center. And you have to have taken that in order to put your name on the website, so that you know what are the basic expectations. And then it goes over the challenges in a mentor relationship. What happens when it doesn't work? Because it's kind of like dating. Your first mentor may not be the right one, and just because you were my mentor now in my first year of practice doesn't mean you're the best fit at year 20. And how do you get out of that relationship? And that's where our mentor champions have also received extra training on how do you help when that doesn't work, because it's not necessarily a fail of the relationship, it just means it wasn't the right fit. So I think all of the competencies for mentorship are really important, and just assuming that somebody can be a great mentor without actually teaching them and giving them the skills is probably not the best practice.
I really appreciate the presentations today. Thank you. And I don't think your hands probably went to bad use, so that's good. When you were talking about this, I was thinking that mentorship, when I was training, I always thought of it as sort of altruistic, but it's not really that now if it's becoming part of a job and mentors are getting hours and on the route to tenureship or something. Do you have like a non-nominal reporting? So, you said these forms have to be done twice a year and so on. Is that labor intensive? Are they saying the right thing, or are they just saying this to get through the process? Do they have a way of commenting on the pitfalls of the system if it's not working for them?
Yeah, that's a great question as far as our continual quality improvement. And it's a process that's that's continuing to evolve. The mentorship committees feed back to the chairs feed back to the champions, and the champions we meet quarterly, and we go over what's working, what's not working, how do we improve our process. One of the other big changes that happen is our university has a large distributed network. How are we properly fostering mentorship growth within our distributed network and our faculty? So we're starting to develop that program as well to make sure that our distributed network is also being properly mentored. Do we have a formalized QI process, surveys that are going out, record keeping of all of the forms? No, not yet. Is it something we would like to do? Yes. And what are we doing to support our associate professors and our full professors, which is 20 years of your career after you've been promoted? And that's the next step to our program. And what do their mentorship committees look like? And I think those mentorship committees will look different. They'll have national presence, they'll have international presence, and hopefully that will improve the academic productivity of our associate and full professors. Our current program really has focused on the first 7 years of the academic career until you hit career rank of associate professor.
Even if and when mentorship becomes recognized as a contribution, as an activity, whatever, I still think there's an element of altruism because it must be carried out with the best interests of the mentee. So I think that enshrines altruism in the process. I don't know what my colleagues think.
Absolutely, because it's really about giving. And I think most people who have engaged in it would actually say the best reward for them is to see the mentee succeed. I know for sure that I do it deliberately for my own health because I get a lot of enjoyment to seeing the people I mentor succeed. And that's how I feel good and I feel happy about myself. And I engage in deliberately to be able to feel good for myself.
May I ask the panel to link back a bit to PSI, about our mission, something about the culture that we espouse and our support for physicians and all the interprofessional team. Is there one thing at least that each of you might advance that would be helpful to PSI to reflect on as to what else we could do as an agency to help in the mentoring realm? From each of you.
I think we talked about this at our table of formalizing the process of mentorship such that it's offered to everyone at the pre-submit stage and then the post-submit stage so that there's a formal mentorship process established and that those mentors are trained.
So the grant applicant could identify one, or the dyad could be sort of presented to PSI, but people, if they didn't experience themselves of having a mentor, we'd facilitate such a link? Okay, thank you.
Yeah, the other thing that would be a low-hanging fruit is actually just providing training on mentorship for all the trainees and their mentors that you're supporting, because it's a relationship. I mean, I remember a few years ago, my wife and I actually went for training, and I was learning how to be a better husband, and she was learning how to be a better wife. So, and this was training at church, and I kind of thought, I wish I had received this much earlier in this journey, And I think most people honestly would like to help, but sometimes for you to be the best helper, the person you're helping should also be the best recipient of help. So I think introducing them the concept of how they can enhance a relationship, sharing the best practices, might actually be a good starting point.
And I'm going to be brazenly self-interested here in that at Trillium Health Partners, we are just emerging as an academic organization and trying to achieve an academic mandate, we having been a community hospital prior to amalgamation about 10 years ago. And so I think, as per the conversation I heard as I arrived this afternoon, engaging organizations like ours, there will be more as time goes on. We probably will never be an academic health science center, but we still have a learning health system academic mandate. We have learners at all levels. So engaging our faculty and in learning how to, not maybe learning how to submit grants, et cetera, but giving them that feedback, if they're not successful or even if they are successful, things they might have done better. I think that's something that organizations like this could do to help emerging organizations like ours.
Thanks, Joan, for pointing out that it goes far beyond research. The mentorship phenomena, and there's really no end to the scope, potentially. A couple more questions we have time for. Yes, now.
Just have some comments. I personally have felt and believe that we should have mentorship, a mentor for everything in our life. I have somebody for my personal life. I have somebody, like at the age of 50 plus, I started playing soccer. I have a coach for it. My mark of success is when my mentee just supersedes me. That will be my mark of success.
Can I also just say, now the nice thing about really being deliberate in how you spread the message is you're not only providing people with the tools of how to do it well, but you're also giving them, information about the blind spots. All of us had blind spots in mentorship, things to be alert about and so on. So I think we can learn how to do it well, and we can also learn what not to do that could actually make it harder to do it well.
Well, I'd like to thank all three of you for bringing your expertise and your evident passion and knowledge about this topic to share with us in this intimate hour. Thank you. You've given us great food for thought, and we'll end the afternoon with Big round of applause of gratitude.